Okay, so our last speaker for the session today is Dr. Jim Roth, and he is a distinguished professor at the Veterinary Microbiology and Preventive Medicine, and also the director of the Center for Food Security and Public Health, and also the Institute for International Cooperation in Animal Biologics. He's won numerous awards and has also been a co-major or major professor for over 50 master's and PhD students. Very well recognized, and in 2016 he was elected to the National Academy of Medicine, and today he'll be talking about securing pork supply in the event of foreign animal disease outbreak. So let's welcome Dr. Jim Roth.
All right, thank you. I'm going to be talking about our efforts to develop a secure pork supply plan. We've been working for a few years now with USDA, state officials, and industry, planning for something we hope never happens, and that's one of these high-consequence foreign animal diseases. The co-author with me is Dr. Pam Zabel, and she's sitting over here to back me up for the questions I can't answer. So there are 3 foreign animal diseases that would be very high consequence because we would lose our exports. That's foot and mouth disease that affects all cloven-hoofed animals, so cattle, swine, sheep, goats, deer. Classical swine fever, which is also known as hog cholera, only affects pigs, and African swine fever only affects pigs. It's very important to remember these are not public health concerns, they're not food safety concerns. And if we ever get one of these diseases, we need to get that message out very quickly. But we would lose our exports with these diseases. On day 1 of any one of these diseases, all of our exports would be gone. For FMD, it would be exports of all of the uncooked products from cattle, swine, sheep, and goats. CSF and ASF, it's uncooked products from pigs only, pork products. And that's different from porcine epidemic diarrhea virus, Seneca Valley virus, which were also foreign animal diseases, because these 3 diseases are listed by the World Organization for Animal Health. And there are 201 member countries of the OIE, the World Organization for Animal Health, and we've all agreed to abide by the Terrestrial Animal Health Code. These are diseases that some countries have them, some don't. And nobody wants to spread these diseases from one country to another. So the World Organization for Animal Health and the World Trade Organization have agreed, and all the member countries have agreed that anybody who is free of these diseases and has a case notifies the World Organization for Animal Health on day 1. They notify all 201 member countries immediately, and immediately all of your exports of fresh and frozen products stop. And if they're on a ship on their way somewhere, the ship has to bring it back. So we immediately lose our exports. Control areas will be established around the infected premises, and those are a minimum of 6.2 miles. It might be much larger. And no animals can move within that control area without a permit. Even feed movement, manure movement has to be permitted. So suddenly there's a stop movement. Prices will drop because we lose our exports, and then we have to convince the consumers that it's okay to eat the products. These are bad animal diseases, but they're not human diseases. This shows what's happened since 1988 with our the export of federally inspected product. You can see in 1988, if we lost our export market, it wasn't a big deal. We weren't exporting very much, but we've been very successful in increasing our exports. The blue line is pork. In 2016, we exported about 26% of our pork and about 14% of our beef. In 2003, there was one case of mad cow disease, which completely stopped all export of beef for a short period of time. And then it took several years for the exports to go back up again, and it hit the price of beef pretty hard. So if we lose that, and between beef, pork, and dairy exports, it's about $19 billion a year, and that would be gone on day 1. And there's not much we can do about that, but we can plan to handle the disease. So foot and mouth disease is the most contagious disease of animals. It's highly contagious, and 96 countries in the world have it and have always had it. So it's out there in many countries. So there's a big danger that it could come in accidentally or intentionally into the US. And we've had 9 outbreaks of FMD between 1870 and 1929. So in a 60-year period, there were 9 outbreaks, and now we've gone 88 years without another outbreak because of regulations that have been put in place on importing animals and animal products. And we've also been very, very lucky not to have an outbreak for 89 years. All of those 9 outbreaks were controlled by stop movement and stamping out. And that was a long time ago, and there were no diagnostic tests. You just see the sick animal, you recognize the lesions. The government officials would stop all animal movement in the region and kill all of the animals on the affected farm and any neighboring farms. So that's stamping out. And you have to do that quickly so that the virus doesn't spread. And that worked 9 times. And that's been our plan up until about 10 or 15 years ago, when state and federal officials in the industry began to realize we may not be able to stamp it out because our industry has grown so large. We have very large herds. You know, feedlots with 75,000, 100,000 cattle, dairy with 10,000 or more lactating cows, very large swine operations. And you just can't kill them quickly enough. And if you could kill them, you can't get rid of the carcasses. So we may not be able to stamp it out. And these large operations tend to be co-located in the same part of the country. So if it gets into one, it can easily spread to others. We saw that in 2015 with avian influenza in Iowa, where in a 2-month period, 31 million poultry died from avian influenza, and it was concentrated in the north and northwest part of the state, where there were a lot of really large operations. And we have inadequate biosecurity to stop, especially foot and mouth disease, because when you consider the integrated swine industry has pretty good biosecurity. It wasn't good enough to stop porcine epidemic diarrhea virus, and it's not doing a very good job of stopping Seneca Valley right now. But then you consider the beef and dairy industries, where the animals are outdoors, and there's almost no biosecurity for stopping a disease like foot and mouth disease. As I mentioned, if we could kill them, we'd have carcass disposal issues. You can't get rid of that many carcasses very easily. We saw that with avian influenza, with the chickens especially. We have extensive movement of animals. It's estimated there are 1 million pigs on trucks every day, and about 400,000 cattle or 500,000. And when a virus disease comes in, the animals are infected for a few days before they look sick. So there's a good chance we may have moved infected animals before we know we even have it, and it might be fairly widespread. And then we have large feral swine and deer populations, and they move fairly freely between herds, and they can carry the virus with them, either because they're infected or just on their hooves, and spread the virus. So there's a lot of people are very concerned if we get it, it might get out of control. So how do we control foreign animal diseases? Stop movement, I mentioned, so don't move any animals, so you're not moving the virus. Biosecurity is extremely important. Stamping out, and I've just discussed how difficult it is to do any of those. The swine industry depends on movement, but there would be stop movement orders. Trace back and trace forward, so you can find which animals came onto the place in the last 28 days and which animals left and where did they go. And we don't have very good traceability right now, especially in cattle. Rapid diagnostics, we're in much better shape there than we used to be. And then vaccination. We'd want to use, if we can't stamp it out right away, we'd want to use a lot of vaccine quickly to stop the outbreak. Problem with foot and mouth disease is it isn't one disease. There's 60-some different strains, and it takes 23 different vaccines to cover all 60 strains. And you don't know which strain you're going to get, so a vaccine bank should have 23 strains in it. And that's very expensive to maintain. So, and we don't have adequate vaccine for foot and mouth disease or hog cholera, and we won't have it quickly in the volume we'll need, because it's just not out there. So, and for African swine fever, there is no vaccine. Nobody's got a vaccine for that. So vaccination won't be a viable option initially in the outbreak. It'll take months to have enough vaccine. So we're going to need to use biosecurity and other measures. So when it became apparent we may not be able to stamp it out, and it might get out of control, in developing these plans, we came up with the types of foot and mouth disease outbreak. Because if possible, you want to stamp it out. If you get lucky and it's a small outbreak, you want to put all of your resources into stop movement and killing all those animals to stop the virus. But if you find out it's spread, you get to a point where it's not possible to stamp it out. So a type 1 outbreak is a focal outbreak with small numbers of animals, and in that situation, all the resources would go to quickly killing all of those animals to stop the virus. Type 2 is a moderate regional outbreak. It's not spread too far. It's not a high-density region. Keep stamping it out, but add vaccine to slow the spread, perhaps. A type 3, a large regional outbreak, probably we have to give up on stamping out, and we'd want to count on vaccine to stop the outbreak. Type 4 is a widespread or national outbreak. Type 5 is a catastrophic U.S. outbreak. And type 6 is catastrophic North American, U.S., Canada, and Mexico. If we don't have vaccine, and we don't currently have nearly enough vaccine, it's going to be very hard to stop it from going up to a type 5. At type 5, the recommendation is to stop the emergency response and transition to a control program, like brucellosis control, tuberculosis control, the hog cholera control program that we used previously, pseudorabies control, which means we would have it for several years, and it would take a long time to work out of it. And this is different. In just 10 or 12 years ago, the plan was just keep killing them till the virus is gone. But these incidents are handled by the Incident Command System, which is a way that the federal government developed to manage forest fires. And in forest fires, you've got a little forest fire and you go in and you put it out, but if the fire grows and it threatens to blow past you, you back up and develop a new strategy. And that's kind of what this is. You do what's possible until it's not possible anymore, then you back up and have a different strategy as it gets out of hand, if it gets out of hand. So the National Pork Board funded Dr. Dermot Hayes here at Iowa State to do an economic analysis of foot and mouth disease if we got it in the U.S. And he did this in 2011. And he estimated that the cumulative losses over 10 years, because if we get it and it gets out of control, we'll probably have it for 10 years, was $200 billion. Pork, $57 billion, beef, $71 billion, poultry, $1 billion, because if pork and beef are cheap, then the chicken is cheaper. Corn, $44 billion, and soybeans, $25 billion. Because if we feed fewer animals, there's less demand for the corn and soybeans, and wheat, $1.8 billion. So it isn't just the livestock sector that would take a hit. And Iowa has more at risk than any other state. We're the most livestock-dense state. We've got 24 million head of susceptible animals, about 20 million pigs, the rest mostly cattle. Texas has about 17 million. That would be the number 2 state for livestock numbers. We're number 1 in corn and usually in soybean production. A lot of Iowans are employed in the production and processing industries, and that would take a hit. And state tax revenues would take a hit. So the economic consequences would be rather severe. So that brings us to the planning we've been doing, secure food supply planning. We started in 2007 with avian influenza planning, secure egg supply, secure turkey supply, and secure broiler supply. And those plans were in place and they were used in 2015 when we had the avian influenza outbreak. And those plans did facilitate movement of eggs and turkeys from a control area where there's a stop movement order. The plans were in place were how could a premises with no evidence of infection still move their eggs or move their turkeys to slaughter. And that part of the plan worked fairly well. For foot and mouth disease, we have a secure milk supply and a secure beef supply plan. And for foot and mouth, classical swine fever and African swine fever, a secure pork supply plan. And these plans were developed with federal, state, industry, and academia working together. The goal is to provide a workable business continuity plan for pork premises with no evidence of infection. You're in a control area, you're under a stop movement order, but your herd has no evidence of infection. And how can they begin to move their animals and make other movements that are necessary while they're under a control area? And these are voluntary plans. Participation ahead of time is voluntary. Participation during the outbreak is not so voluntary. So it's, as I mentioned, it's a partnership developing the plans. USDA APHIS has funded the development of the plans, and the Pork Board has put some funding into the pork plan. It's voluntary participation before the outbreak. If a producer wants to be more prepared, then they can voluntarily participate. Movements either to slaughter or to the next stage of production is what we focus on. How can we, because in the pork industry, it's very difficult to stop movement. It has very serious consequences. And we've developed the plans, we've discussed them with industry, we've practiced, we've revised the plans, and are finalizing them. And we anticipate the plans will be finished by the end of September and ready for implementation. And the National Pork Board is gearing up to help the industry begin to implement, voluntarily again, implement the plans. So the common components of all the secure food supply plans are voluntary pre-outbreak preparedness. And these are guidelines only. During the outbreak, the responsible officials will make the decisions they need to based on the characteristics of the outbreak. But the preparedness emphasizes biosecurity a lot, and we'll talk about that. Surveillance, how will we do surveillance to find the virus? Epidemiology questionnaires, if you're in a control area, you're going to have to provide a lot of information about your premises so that the state and federal officials know what animals have come on, where have they been, what people have come on, what might have brought the virus on. Movement permit guidance for issuing permits, and they're based on risk assessments that are completed and some are still in process. So when you have an infected premises, like the dot in the middle there, a control area will be established around that. And the minimum control area is 6.2 mile radius circle. It might be much larger. But a 6.2 mile radius circle is 120 square miles. And in Iowa, that could include a lot of cattle, swine, sheep, goat premises. And in that circle, or control area, movement is based on permits. You have to have a permit. You can't move anything without a permit. So how can you get a permit for movement? And that's what the secure food supply plans are about. So on day one of an outbreak of one of these three diseases, there will be stop movement in the control area. They'll establish the control area. They'll let everybody know, okay, you're in a control area, you can't move anything. There will be animals on the road already. Like I said, there's about 1 million pigs on the road every day. If they came from a control area, then something has to happen, be done with those pigs that are on the road already. And the recommendation is they continue to their destination. If they're on their way to a slaughter plant, they should go ahead and be processed or sent back to where they came from or handled somewhere in between if possible. And then it'll be a few days before anything can move. So producers need to manage their animals, be prepared to manage animals without movement for several days or perhaps several weeks. And in some of our systems, that's hard to accommodate because it depends on movement. It's very important that everyone have a premises identification number, and that should be done ahead of time because you can't do anything without a PIN. You can't request a movement permit. The state and federal officials can't track the animals. So everybody should have a premises identification number ahead of time. And the pork board is working with the pork industry, and you probably have heard this, I'm sure, how to get your PIN. You get that from your state officials. So permits will be required for all movements onto and off of premises during the outbreak. And that'll include feed and manure. Everything going on off the premises will need a permit. And that's because we're trying to not spread the virus to uninfected premises. So for movement of live animals to another production site, the owners of the other site have to agree that they're willing to accept those animals, the risk of accepting animals from a control area that might be infected. And they want to see the diagnostic data and surveillance data to be convinced that it's probably okay. For movement to slaughter, the owner of the slaughter plant has to agree that they'll take those animals. So the permit, the slaughter facility has to agree to take them. The Unified Incident Command, which is state and federal officials, have to agree to the movement permit. And the state animal health officials in the state of origin and the state of destination have to agree. So a lot of people have to agree that, okay, these pigs can move from here to there. We think it's safe and we won't be jeopardizing other premises. So the decision to approve a movement permit depends on the degree of confidence that everyone has that this herd really is not infected, because they had their biosecurity plan ahead, they had their biosecurity implemented ahead of time, they've done the required surveillance, they've filled out their epidemiology questionnaire, and everything looks good. So we're willing to take the risk. And it depends on the status of the state of origin and state of destination. If Iowa is negative and the state of origin is positive, it's going to take a lot of, probably our state animal health officials won't want to take the risk of bringing the disease into Iowa. And that would be the same for any other state animal health official. If they're negative, they're going to be very, very hesitant to take any risk of bringing the disease in. If both states are already positive, then there's less risk, less at risk, especially if they're going to slaughter as compared to another production site. If they're vaccinated, once we get vaccine, that'll make it a lot easier to move animals. Once they've been vaccinated a couple of weeks earlier, then they're pretty well immune to the disease and can more easily be moved. Or if they've recovered from infection. If we stop killing them, then we're going to have to deal with herds that have gone through the disease and recovered. And those that have recovered and returned to health can be sent to slaughter if they can pass FSIS inspection, and they're immune. So they shouldn't be shedding virus, they shouldn't be susceptible to virus. So it should be easier once they're either vaccinated or recovered to move them. And the consequences of not allowing movement. If this outbreak goes on and we're not allowing movement and a lot of animals have to be euthanized for welfare reasons, then the pressure builds up to start allowing movement because of the consequences of not moving. So there's a lot of factors that go into making the decision. So how can producers prepare ahead of an outbreak? Well, we have the Secure Pork Supply Plan summary. It's drafted and it's on the website that I'll show you at the end. It's about 6 pages and it outlines all of the steps in the plan and what you would need to do to be eligible to request a permit. In this 6-page plan, there's a lot of links to more documents. So it'll say, have your biosecurity in place, and then you can link to the biosecurity steps. So there's a lot of other information in there if you want to voluntarily do this ahead of time. So biosecurity is the #1 thing you can do to protect your premises from getting infected. And biosecurity is expensive and it's inconvenient. If you're going to follow all the biosecurity protocols, it takes more time, and you have to do it right all of the time. And producers implement the level of biosecurity needed to protect from endemic diseases. And that's what they have to do to stay in business. You got to protect yourself from endemic diseases so your animals are reasonably healthy so you can be profitable. But for endemic diseases, there's a level of herd immunity. So the animals are already mostly immune because you vaccinated them or they're exposed. So there's low level of shedding and high level of resistance. So biosecurity for endemic diseases is easier. For these novel foreign animal diseases, the routine level of biosecurity is not sufficient to protect from highly contagious diseases where there's no herd immunity. If animals get infected, they shed very high levels of virus, and it only takes a little bit of virus to infect animals that have no immunity. And we saw that in the avian influenza outbreak, that it's the layer industry in Iowa, where they have 3 or 4 or 5 million hens in one site in buildings, had what we thought was pretty good biosecurity. And it was good for the normal diseases. It wasn't good enough to stop avian influenza. So the industry had to completely revamp how they do biosecurity and increase it extensively. And this swine industry will have to do that if we get one of these diseases. So there's structural biosecurity, and that's built into the facility. That's the building the animals are in and how tight it is, and do you have a biosecure entry procedure? Are you keeping out birds and rodents and so forth? Then there's operational biosecurity. And that's the standard operating procedures followed by all of the workers on site, all of the time. And the thing about biosecurity is everybody has to do it all of the time. Even on weekends, even at the evenings when nobody's watching, you've still got to do the biosecurity all of the time. So we've revised the biosecurity recommendations based on the experience with high-path avian influenza. And the new recommendations in the poultry and swine industry for animals housed indoors includes some concepts that may not already be there on most operations. One is a biosecurity manager, one person who's responsible for biosecurity on that site all of the time. And that person is responsible for writing a site-specific biosecurity plan, a plan for that site, and training all of the workers, all of the service technicians, all of the truckers on what they have to do for biosecurity. And there's a line of separation concept and a perimeter buffer area concept that I'll go into. And it's the producer's responsibility to keep their animals from becoming infected. And that's always true for all diseases. It's the producer's responsibility. The site-specific biosecurity plan is needed and has to be adhered to by everyone all of the time. So if you're in the plan, in the secure pork supply ahead of time, you'll have a site-specific plan that people are following. And the biosecurity manager has to have the expertise in infectious diseases and production animal agriculture and be familiar with that site. So usually the herd veterinarian should help to develop the biosecurity plan. And then the on-site manager makes sure that it's being followed all of the time. The line of separation concept is an important concept, and that is that nothing should cross the line of separation that can introduce infection. So it separates the animals from all sources of infection. And for animals housed indoors, it's the walls of the building. So nothing should cross into that building that can infect the animals. So, and that's your defensible line. You defend that line so nothing crosses. For animals housed outdoors, it's a lot harder, but the line of separation concept can help. And I'll show you a couple of examples. The perimeter buffer area is aimed at reducing the contamination around the buildings, in the vicinity of the buildings, so that there's less chance it'll get carried into the buildings. And you can't completely eliminate potential infection outside of the buildings, but you can greatly reduce the concentration. So the biosecurity plan, which is available on the website, there are 12 points in that plan. If you want to implement the biosecurity, there's a self-assessment checklist for these 12 points. The biosecurity manager in the written plan, the training for the employees, protecting the pig herd from introduction. What do you do with vehicles and equipment so you're not bringing infection onto the site? personnel, especially going in and out of the buildings, animal and semen movement, how that can be done safely, carcass disposal, manure management, rodent, wildlife, and other animal control, and then the feed. Any of those can bring in infections, so you want to make sure those are all managed. And for each of those in the self-assessment checklist, you can say it's in place or in progress or not in place. So you assess your own premises. And then we have an information manual for enhanced biosecurity, a manual of how to achieve each one of those things, different options to help you implement the biosecurity plan. So you need to explain how on your site you will accomplish all of those biosecurity steps. And one of the things that's needed is a map of your plan. And the easiest way is to get on Google Maps and get a picture of your premises. Draw the line of separation, which is the walls of the building in this case, the perimeter buffer area around the building, traffic flow for feed trucks, propane trucks, carcass disposal, where do the carcasses go? So all of that's laid out on your plan for anybody to see. And you need a biosecure entry procedure to get across the line of separation. And it's also called a Danish entry procedure. So basically, and you don't have to have shower in, shower out, although that would be optimal. But the workers come in from the outside, they remove their outer clothing and their shoes. They sit down on a bench, remove their shoes, swing their legs over the bench, wash their hands, put on coveralls and boots that are dedicated to that building. And then you go into where the pigs are and do what you need to do. When you come out, you reverse the procedure, leave the coveralls and boots on this side of the thing, swing your legs over, put on your shoes and your coats, and leave the building. And any equipment you take with you needs to be clean and disinfected. Can't come from another premises. It either needs to be come from a clean source or disinfect it before you bring it into the building with you. So this shows an example. The green is the buildings, and this is buildings that are connected by a walkway. The red line is the line of separation. So workers, in this example, enter into an employee building. They go through the biosecure entry procedure, put on boots and coveralls specific for the building, and then they can go between the buildings at that point. The blue area is the perimeter buffer area, and that's the area around the buildings, and any vehicle that enters that area should be cleaned and disinfected. And the advantage of the perimeter buffer area is if you put it carefully, then like in this example, feed trucks can come in and stay on the driveway. They don't enter the perimeter buffer area, so they don't have to be cleaned and disinfected. And then they can just auger the feed into the feed tank without the vehicle crossing the perimeter buffer area. Because I know you all realize it's very hard to clean and disinfect trucks in January in Iowa. So the less of that you have to do, the better. And then there are perimeter buffer area access points. So if you need to bring equipment in, there should be a cleaning and disinfection station. Maybe just leave the equipment in there if you can, so it's not going back and forth. But that way, people walking within the perimeter buffer area aren't getting heavily contaminated because you had contaminated trucks. And you park the vehicles, the workers' vehicles, outside of the perimeter buffer area. This is another example where you have 4 separate buildings that aren't connected. Each one of those needs a biosecure entry procedure. But again, the feed trucks can drive on the driveway, auger the feed in without needing to be cleaned and disinfected. And then you need a carcass disposal mechanism. For example, any dead animals would be transported to the dead box, and then the rendering truck backs up here without crossing the line of separation and removes the animals. So you're not getting contaminated from that rendering truck. So that's the biosecurity, and those again are on the website that I'll show you. Then there are surveillance guidelines. These guidelines list the different kinds of tests that can be done, the advantages and disadvantages, and the regulatory officials will tell you which tests to do and when to do them. But we're going to want to see testing right before the animals are moved to have a higher degree of confidence that they really are negative for the disease. And then there'll be an epidemiology questionnaire. So you need to keep records so you're ready to fill out the questionnaire. Where have all the animals come from that came onto your premises in the last 2 incubation periods, which is 28 days? And all of the people that have come on, have they signed a visitor's log, and have they not been on another premises before they arrived? So and where do your workers also work? Do they work somewhere else that might be contaminated? So you'll need to fill one of those out before you can request a movement permit. And this helps you to know what records to keep to be ready. We have training materials developed on this website, securepork.org, for training employees to help with the training, and they're in Spanish and English, or will be. And then you need contingency plans. So what about in inclement weather? Windy, rainy day where you can't disinfect things, middle of January, you might need a sheltered area to do cleaning and disinfection, or an off-site location. What are your contingency plans if you can't move animals for a few weeks? For the welfare concerns, carcass disposal, if you can't move carcasses off-site, can you dispose of them on-site? And manure storage. If you're not permitted to move manure for a period of time, do you have sufficient capacity for storage? So there's some difficult things that might need to be dealt with. And if you get infected, if you get infected and not stamped out, so your animals are infected and you have to see them through the infection and they recover. You need to be ready to deal with increased death loss, because these diseases, some of the animals will get very sick and some will die. Foot and mouth disease, usually adult animals recover. Baby pigs and baby calves can have high mortality, up to 50% or more, depending on the strain of the virus. Like any other disease, there'll be a poor rate of gain, poor feed efficiency during the illness, and they may not fully recover to health. They might continue to have poor feed efficiency after they recover. If there's no mandated depopulation, there's no indemnity. If the federal or state government tells you the animals have to be killed and they come in and kill them, they pay you for the value of the animals. If they don't kill the animals, there's no indemnity. So then, like any other disease, the producer has to stand the loss of the disease. There'll be a dramatic drop in the price of pork due to loss of exports. And you may need flexibility in contract arrangements. Maybe you've got a contract that you're doing contract feeding, you're contracted to deliver to packers, and now you can't deliver. You've contracted for feed purchases, and now you don't need so much feed. So you might need some flexibility there. So it's not a good scenario. We've worked on these secure food supply plans, but it's still not a good scenario. But we need to be ready. But if you participate, it reduces the likelihood that your herd will become infected with the foreign animal disease, enables the movement of animals sooner. You still might not be able to move for a few days or a few weeks, but if you're in the plan ahead of time, you'll probably be the first to be able to move. And it contributes to the overall success of the eradication program. And we didn't used to worry about these diseases so much because, like I said, we haven't had foot and mouth disease for 88 years. We haven't had hog cholera since 1977, and we've never had African swine fever. But we never had high-path avian influenza like we did until 2015. We never had PED virus. So we're seeing these viruses move internationally more than we used to. So we really need to try and be prepared for these. So this is the website. We've got plans up there now. They'll be finalized by the end of September. And you'll be hearing a lot from the National Pork Board about preparing and implementing these plans voluntarily. So with that, any questions?
Questions?
This might be in the category of fake news, but we would have heard, I guess. The military supposedly discovered in Afghanistan with the bad guys with a manual of how to do this.
Yeah, so whether it comes in accidentally or intentionally, it'll be hard to deal with. So there's agro-terrorism potential, that someone could do this on purpose. And I don't know why they haven't done it yet, actually. Because as you mentioned, they did find evidence in the caves in Afghanistan, plans for introducing some of these diseases. But whether it's accidental or intentional, the response is going to have to be fairly similar.
Was there any focus on female biosecurity or potential points of entry?
Yeah, so feed mills, they're going to have biosecurity too. Are you talking about coming in through the feed?
Well, potentially.
Yeah, PEDV may have come in with feed ingredients from China. We know it came from China. That's a very much tougher virus than foot and mouth disease. Foot and mouth disease is a little more easily killed. But that's why feed is one of the biosecurity checklist items. The feed should be delivered in a covered container and put into a covered bin and not exposed to the environment. The feed trucks need to be using some biosecurity between premises. So.
Has there been a big change in the border inspection methods used since then?
I don't think there's been a big change. It's been one of the reasons we haven't had one since 1929 is they don't allow the import of meat, fresh meats from any country that has FMD or live animals from those countries.
Well, the reason I ask that is we bought pigs from a naive herd in a negative province, and they became infected and were sick by the time they got delivered because of the border.
What disease?
Pets.
Huh?
That was pets. But it wouldn't make any difference what disease. If you're spreading it with the inspection crew, you're going to spread it with the inspection crew.
Oh, the inspection crew
spread it? Well, that's the only place that could be possible because the pigs were sick when they arrived and it was 18 hours and they were negative at the source.
One of the problems with laboratory surveillance, and that's the best we can do, is that as with any disease, human or animal, you can get infected and it's a day or two before you test positive, a day or 2 or 3. And you feel good, but the virus is replicating. You can't find it on testing. The animals look healthy. But that's why we say no evidence of infection. We can't say they're not infected. There's no way to prove an animal's not infected. All you can say is there's no evidence. But they could be incubating it. So that's a problem.
Well, they weren't incubating it at the source.
Because the source stayed negative, so they got infected somewhere in between. That wasn't in the U.S. or?
The source was Canada. The source was negative. The province was negative. The border seems to be the source.
So it wasn't one of these 3 diseases?
No, it was pets.
PED.
Oh, okay, PED. Yeah. Canada's more worried about going the other way, but yeah.
My point is that we don't want to be shooting ourselves in the foot at the border by having our inspectors spread it around.
Yeah, the inspectors need to use biosecurity also. Everybody's going to have to use biosecurity. Yeah.
Is there a restriction for the employees and the feed trucks when they live in the infection area?
So research on the employees and feed trucks?
Restriction.
Oh, restrictions. Yeah, there will be restrictions if they're in the control area. Now, the control area could end up being several counties or a whole state or several states. The minimum is 6.2 mile radius, but it's likely the control area would be much bigger. And then if you're going from a herd with no evidence of infection in a control area to a slaughter plant in a control area, there's probably more likely to get a permit. if you're staying within the control area. So it depends on the size of the control area.
People cannot travel outside.
For people, it's really hard to restrict people. I mean, if you have, people living in a town that's in the control area, you're not going to, but they shouldn't be going on a farm. That's where they get infected, is on a farm. Other questions? I think we're out of time. I'll be around for a little while.
Let's thank Dr. Roth one more time.